Who here has heard of MRSA? What is it?
Is it staph?
Yes. However, it is a antibiotic-resistant strain of staph. The acronym is methicillin-resistant Staphylococcus aureus. Unfortunately, it is becoming more and more common within our community. Did you know that, according to the CDC, 1 in 3 people already have Staph aureus in their nose, and 2% of those people are carrying the methicillin-resistant strain? There are actually 2 types of MRSA, the healthcare-associated and the community-associated. Today I will focus on the latter of the 2 because the average person is more likely to be exposed to this type within our community. I've done some research and would like to share with you a brief history of the bacterium, along with risk factors, symptoms, treatments, and prevention techniques to avoid exposure in our community. Before I share this research, though, I would like to cover a few key words. First one is methicillin, a semi-synthetic antibiotic derived from penicillin. Next is epidemiology, a study of how disease develops and spreads. MSSA, a methicillin-susceptible Staph aureus. It's essentially a staph infection that can be treated with typical antibiotics. Next is abscess, which is a swollen area of tissue that's often filled with pus. Then there's prognosis, the course of a disease. Cellulitis, which is the inflammation of connective tissue below the skin. And sepsis, which is a widespread inflammation caused by the infection. Next, talk about the timeline of MRSA. The first strain was identified in 1961 by British scientists. In 1981, the first major U.S. outbreak occurred. It actually happened in Detroit, Michigan, due to intravenous drug users. Between 1998 and 2008, called the epidemic decade, there was a tremendous increase in the amount of outbreaks, hence the name. In 1999 was the first U.S. Death of a child due to MRSA, and in 2005 there were 94,000 infections in the U.S. alone, and of those 18,000 died. That year, the amount of deaths exceeded age-related deaths. There are several risk factors associated with community-associated MRSA. Who do you think is at a higher risk of contracting this?
The elderly?
Why do you say that?
Because I used to work in a nursing home, and that's where I've heard of staph infection before.
Yes, and the reason being is because they have an already weak immune system and they're very susceptible to these infections. Also, athletes, incarcerated people, emergency room patients, and HIV patients are also acceptable. One you can relate to is military recruits. Whenever they are in basic training, they're in these closed corridors with in a high population, and there's a lot of bacteria, so they're easily exposed to MRSA, especially. Symptoms associated with MRSA generally tend to show as a pimple or an insect bite, as you can see here, and it's generally paired with pain and sometimes even a rash. And as it progresses, it turns into an abscess, and it's filled with pus, and as you can see, it kind of drains a little bit from the excess pus. As far as treatment is concerned, most infections are generally treatable. If there's a localized abscess, the doctor will generally lance and drain the pus that's inside of the abscess. In some cases, this is often paired with a sulfa drug or a tetracycline. And these broad-spectrum antibiotics, however, should be used with caution. The reason being is that they can create a superinfection if used too often due to the fact that they kill the good bacteria in your body. Preventing the spread of MRSA is actually quite doable. According to the CDC, the easiest way to prevent it is to maintain good hygiene. These things include washing your hands frequently, taking regular showers, generally daily is good, and then also if you have a wound, to change the dressings frequently and to make sure that it remains clean. You'll often avoid getting any kind of infection. Considering what you have learned about MRSA today, you should now know that it is not a subject to be taken lightly. As researchers and healthcare professionals continue to monitor the epidemiology of the infection, they are also searching for different ways to beat the MRSA. We as citizens of the community should be supporting the fight as well. Understanding the risk factors, symptoms, treatments, and how to prevent it can lead to a overall better health in our community. Something as simple as washing your hands and singing the alphabet while you wash your hands can help to extremely lower your percentage of contracting it. A little known fact is that also in illegal drugs there is a ingredient that will inhibit the growth of MRSA. For example, THC in marijuana, and also the active ingredients in psychedelic mushrooms. It's a little information for you. Yeah. Stop.